C'est parfait.
Thank you. So I'm happy, to briefly present you, the activity of our activity, and especially at European level and on e-health issues in Brittany. So just a few words on our innovation ecosystem. We have about 260 innovative health companies in Brittany and 200 biotech companies. Of course, we're a region which is quite on the top for agriculture and agri-food region. And also we have a leadership in the marine biotechnology. But today I want to put the emphasis on our status on e-health questions, as we are second region in France for research and development in digital technologies, and third for health tech. Biotech Santé Bretagne is a technological innovation cluster. We cover 7 markets. We have about 200 members, part of our association, among which 2/3 are companies and 1/3 are academic stakeholders in health institution. But today I want to put the emphasis on the one Interreg North Sea project that we are part of, which is coordinated by RISE Institute in Sweden, which is called ACE for accelerating the home care innovation ecosystem in the North Sea region. So this project is really willing to accelerate the use of innovative solutions in this area of home care. The idea is really to create a digital community of hundreds of stakeholders to connect solution providers with the different stakeholders of this area that can be both health institution, researchers, or also associations of patients. The goal of the project is to put the emphasis on 30 innovations that will directly address care user needs, thanks to showcase activities, but also pilot sites. And I will say a few more on this a bit later. After having identified these innovations, the idea is to come to push for adaptations that could be organized for about 150 adaptations in the North Sea region for home care providers. And the idea is at the end also to train the health professionals on these innovations and to train them for knowing more how to use them in their day-to-day activity. So we are really happy, and we would be happy to welcome you, to welcome SMEs, digital solution providers working in the field of home care, especially in the North Sea region, because this is the eligible area of the project. But I think if some of you are also interested, we can also invite you to participate in some events that we will organize during the project. To invite also care providers, NGOs, or senior citizens to be part of this community. That will be always very interesting for sharing our results. So the project has launched an ACE community platform. And the idea, and this is why I wanted to put the emphasis today on this, we already have close to 190, practically 200 members already part of this community platform, and we want to push for more stakeholders to come, and notably SMEs. We are at the stage that why do you want to enter and to be part of this ACE community platform for SMEs? That's the occasion to be visible and to put the emphasis on these solutions for them to be better known at EU level. You can register for free. You can experiment some, test your solutions in Europe on different markets. So the idea is to have some solutions with TRL from 7 to 8 or more, quite close to the market, and to push them to collaborate and to test their solutions with health institutions, for example. We have different pilot sites in France, in Belgium, in Denmark, Sweden, Netherlands, and Germany. And so the next steps, because we have a time schedule that was quite precise for the next experimentations. So to start testing your solutions in April, so please register by the end of January, and then you can see the different dates. Then we'll have a second round of testing periods for if you want to start and experiment your solutions in June, then register before end of March. And if you want to test it in September, that will be the last opportunity. You can still register till the end of June. So this is the ACE community platform. So it's a really, quite a very important tool for a project, and it will enable first these pilot sites to be organized. So with these home care solutions to be tested in different health institutions in other countries. Also it will enable a certain number of events that will emphasize the different advancement of the project at European level. So if you are interested, please contact me. And if you have any questions, I'm happy to answer it today.
Well, there you go. If you didn't know about the Bretagne region and